In this short video, we're going to talk about transcranial direct current stimulation, or tDCS for short, and what will happen if you take part in our study. tDCS is a type of brain stimulation. It involves applying a very low intensity electrical current between two electrodes placed on your head. tDCS is safe for most people, but to make sure it's safe for you, we'll ask you some safety questions. These will be carefully checked by an experienced researcher. We'll also ask you these questions before you visit us at the university, so that we can check that this part of the study is suitable for you in advance. The first thing we'll do to set up the stimulation is take some measurements of your head. This will help us work out exactly where to place the electrodes. We will use large rubber bands to secure the electrodes. The bands need to be snug so that the electrodes don't move about, but they shouldn't be so tight that you find it unpleasant. One electrode will be placed on the top of your head, and another on your cheek. These electrodes will be a bit wet, as this helps the electrical current and makes the stimulation more comfortable. Holding the electrode securely in place is important, because the electrical current needs to be able to flow across your scalp and between the two electrodes. This is also the reason we will ask you if you have very thick hair or braids before coming in. These hair types and styles sometimes mean that tDCS won't work, as the electrodes can't get close enough to the scalp as they need to be. If this applies to you, the researcher will discuss this with you and other options for the study. Once the electrodes are in the correct place and you are happy to start, the electrodes will be connected to the tDCS machine and it will be switched on. In this study, you'll experience tDCS for 20 minutes, during which we'll complete some tasks on the computer. You will then have a 20-minute break before experiencing tDCS for a further 20 minutes. tDCS is very different from other forms of brain stimulation that you may have heard about, such as electroconvulsive therapy, or ECT for short. It uses much lower electrical currents, and during tDCS, some people feel nothing at all, although experiencing an itching, tingling, or slight stinging sensation under the electrodes is also common. These sensations are usually mild and fade after a short time, but if you find them too strong or too uncomfortable, you can ask the experimenter to stop at any time. At the end of the tDCS part of the study, the electrodes will be taken off. The effects of the type of tDCS that we are using in the study typically wear off after a short time, but please do let us know if you feel or experience any negative sensations or symptoms after the study, and contact us if you have any concerns.